Good morning.
Good morning. I'm Maggie Thomas. I'm a client care coordinator here at Home Instead Senior Care, and I handle all of the waiver clients.
And I'm Holly King, and I'm a client care specialist, and I handle the private pay clients. Today we wanted to talk about effective communication to each other and to the office, as well as ideas and activities to do with our clients and to keep them active and sociable.
So first we're going to start off with the change of shift report. This is just something nice that we really want to encourage everyone to do, whether you're at a share care home or you're in your client's home. We have so many different caregivers going in and out of homes. We just want to make sure that a report is being passed on through each shift.
It's similar if anyone has worked in a nursing home setting or another type of setting where you're conveying to the next shift what occurred during your shift. This is going to be a handout that we will make sure that is in your packet of information, and then we are going to put it in the client's binders for a reminder that this actually really should be happening between caregivers from shift to shift.
Now, obviously, we don't have continual 24/7 care in all of the homes. If you do find that that's an issue, maybe our suggestion would be to have a binder or even use this piece of paper, and we can add them to the binder as well. Just like leave a little note for the next caregiver. So even if you leave at 2 o'clock and the next one doesn't come till 5, leave a little note just explaining what happened on your shift, whether it was positive things, maybe if something bad happened, or anything that you noticed, or you weren't able to finish the laundry, or something. Just a little note would be nice to give each caregiver after each shift.
So I think we're just kind of going through it. The first discussion would be skin issues. Has the client had any skin issues? Did you shower them? Did you notice any reddened areas? Did you notice a cut, a bruise? Anything to do with their skin needs communicated. If there are changes, it needs communicated also to the client care team so we know we can document it and follow up with families if they have concerns.
Medications are a big issue right now. I feel, even if the client is refusing medications, we definitely need to make sure that we are letting the office know that at 3 o'clock you were not able or successful to give your client medications, and it's a nice way for us to also let the family know and see if they suggest, at 3 p.m. that's fine. If you want to try again at 7 or the next shift, that's fine too. Like I said, we just want to make sure that we are giving the client their medications. Also now, there are some clients that have narcotics in the home as well. So we just want to make sure that we are that we are going to start counting those narcotics. We just want to know from each shift whether or not you dealt with the narcotics or the client needed them at that time. We just want to make sure that we're having a count each shift so we know exactly how many are left over.
The next topic would be toileting issues. Have you noticed any changes in the clients with their continency, whether they're more incontinent, whether they're having more accidents, if they're having more difficulty using a toilet or a bedside commode, if they're having bouts of diarrhea, any changes in their bowel movements? Because those are things that we do communicate with families. Certain medications cause certain side effects. So if you're seeing changes in toileting issues, we would like that communicated and reported as well.
And then also appetite meals. This is also nice just to even know exactly what they're eating during the day. Also just, if it's causing some weight gain or if they're not, gaining weight, it's also kind of know that nice balance. Like I said, it is kind of nice just to see what other caregivers are making for the meals.
Visitors, during the day, did they have visitors? Was it someone out of the ordinary? And are we making sure that we're following the COVID protocols? Are we temping people? Are we asking them to wash their hands? Are they wearing a face covering? That's something that we really do need to stay on top of because it's still a pandemic. So we really want to make sure if there's visitors coming in that we're aware of it.
And then, their behaviors, their mood, that's also nice to know. With if you notice a big change from like the shift yesterday to the shift today, or even 2 days in between, there could be UTIs or, different things going on with them. So it is nice to know if you notice that they were a little down or that they're very confused rather than when they weren't.
Exercise and activities. What did they do throughout the day? And we don't have to think of traditional exercise and activities. We can think of things like, we went through the photo album together today. She talked on the telephone today with her family, or a client was bird watching. Whatever it may be, they did some exercise programs. We just need to know that they're being engaged and that they're doing some type of activity. On the reverse, it could be that the person did not participate. They were very tired throughout the day. They slept more than normal. These are just nice things to communicate to one another so they know what to expect when they're entering the next shift. And it might bring some enlightenment to why the client is acting a certain way.
That's a perfect segue into our next topic. We want to just talk about activities for seniors to keep them active, like Holly was talking about. I don't want you guys to ever feel like you have to overthink for an activity. It could be just, having them pick out their clothes in the morning, or asking them, does this look good together? Or, did you see that bird come through come stop by the window? Let's go over and walk over and see it. That's an exercise for them, just to walk and look out the window. Or, there's so many beautiful things around their homes or in the share care homes. Maybe have them walk over to them and just start talking about them. Or even if you know the answer to a question that, you want to ask them, it would just engage them to talk about different topics as well.
Yeah, we want you to incorporate engagement activities in your day-to-day functions. It could be watching a game show, asking them what they think the answer would be. If it's laundry day, please bring up a bushel of laundry, have them fold, have them participate. A lot of seniors don't want to lose their independence and what skills they do have. If they can help anyway with cooking, if they can help with setting a table, those are activities. And the more they're active, the more they rest well. And that's extremely needed, especially in our clients that have dementia. We have a list of activities that we had talked about in the past, and we're just going to kind of reiterate and go over them again. I think one of the ones is walking. Just getting them up, getting them moving. Even if they're wheelchair bound, they can still move around in their wheelchair, start moving around their arms, moving their legs, getting that blood circulation going.
And I even like this one, exercise doesn't necessarily mean that they're doing aerobic exercises or they're jogging back and forth, from side to side, but, just sitting in your seat, marching with your legs, kicking their legs out, their arms, they can move their arms. They don't have to necessarily have weights, they can just lift and stretch and do things like that. So, definitely fun things to do while you're sitting.
My favorite activity with getting them moving like that would be a balloon toss. Mm-hmm. So it's someone that doesn't have to have an active activity level, but even if they're in a wheelchair, it's certainly easy to hit a balloon, and it's fun, and it's something that is entertaining. Another one would be dancing. Put on some music and think about their genre, their ages. Maybe ask them what they like to listen to. Put on some music, and a lot of times people that are demented, one of the abilities that they keep is singing. They might not talk in complete sentences, but they remember lyrics to music, and they will do a sing-along. And that's always fun to watch.
Yeah, definitely. And I even think dancing in your chair is just as fun as dancing on both feet. Gardening, definitely, we have plenty of plants around the homes. I'm sure, in the summertime it'll be nice, to walk around the yard and just do some fun things. But don't be afraid. Obviously, don't have them bend over to extreme circumstances. But if there is a little pot on their porch, maybe just have them kind of take care of it, help them trim off the dead plants, maybe, water it, and just kind of really care for the plant.
Any arts and crafts. We all have ideas. It can be something simple as adult coloring books. anything that's using their mind, using their dexterity in their hands, using their imagination. It's springtime, maybe cutting out flowers, drawing pictures of flowers, favorite flowers that they had in the past. Maybe with the men talking about fishing, maybe drawing fish, guessing what kind of fish it is. I mean, you just have to use your imagination, and ask them for ideas. Ask the clients what their hobbies were and try to incorporate that into some type of an activity.
Yeah, and even reading, offer materials, look at magazines, look at the newspaper and maybe just say, oh my gosh, did you see that in the newspaper? I know with sports going on, the football teams around for high school and summer activities are starting to happen. Just ask them, look at different things or even offer them. There's so many different communities and different places that you can even get rent audiobooks, so you can even have them listen to a book or like a podcast or something like that would be definitely nice to offer.
Writing, I know some clients are unable to do that, but some can. Maybe they could write a letter to their family. Maybe they could write a poem, or write a letter to a friend and help them mail it. Something as simple as writing and communication and mailing a letter means a lot, and it keeps them busy and practicing. And I'm sure a lot of seniors have beautiful handwriting, unlike we do from texting and everything else. So having them keep that skill up, again, writing some poetry or a letter to someone and helping them through that whole process.
Definitely humor. I say, go into each assignment with a positive attitude, tell a joke or have them watch a sitcom on TV or, just laughing and smiling it's so good for the soul. We
also want to remember that, it is Facebook age and we can do Zoom calls, we can do FaceTime. So if we have the ability to do that with some of the family members and our clients, I know it means a lot, especially for people that are out of town or they don't get to visit a lot. So emailing, FaceTiming, using Facebook as a form of communication is terrific.
And just like we explained before, sorting and helping, around the house doesn't have to be anything crazy. It doesn't have to be all of your chores, but certainly, maybe say, oh my gosh, did you see all these socks? Have them kind of maybe sort through, give them like a couple of pairs and they can kind of match them together. Sorting the deck of cards, just even matching them. I mean, it doesn't have to be a specific game, but even just put all the 2s on in a pile, all the 3s in a pile, all the 4s, things like that, or even by, the diamonds and finding the queens and things like that. So, or even untying some knots. There's so many different activities. It doesn't specifically have to be an activity. There's so many different things that you can just find throughout the day, to have them be stimulated and busy, and that'll help a lot as well.
And we all have the crosswords, the jigsaw puzzles, the board games, the word searches, but we want you to be mindful of it's spring. Everyone wants some fresh air. It's good for the clients if they're capable of getting outside, getting some fresh air, hearing the birds. Anything that you can do, maybe plan a picnic to do even inside, but using picnic style food, anything fun and creative. And if you're stuck and you need some more ideas, please call us. Maggie and I are here to help you. We are here to be an advocate for the clients, but we're here to help the caregivers. We appreciate everything that you do, and we know that you work hard. So these are just reminder techniques. And for effective communication, I think lastly we wanted to say, please call us and let us know of the changes and anything that's going on with the clients. We're not there, you are. And we know that the families are there, and sometimes families will communicate with you or you will communicate something to the family, but please involve us so we're aware of what's going on. So we know when we get a phone call how to act accordingly.
Yeah, I know, like I said, it's happened many times in the past where, like Holly was saying, families will just communicate things to you guys, which is fine, but definitely give us a call and just let us know. And like I said, we'd like to kind of keep their assessments updated, and, you know, we just want to be on top of everything in case there was an issue, and then we also have to explain something to the family that we knew as well, and we could say, well, this happened, or, you know, things like that, so. Okay.
Thanks, everybody.
Thanks, guys, and enjoy yourselves today.
All right.